Welcome to the Mind Body Temple podcast, your healing space with Dr. Rod. The purpose of this podcast is to bring hope to patients with chronic pain, anxiety, and depression. I have the pleasure of having my amazing patient, Sarah, here today with us. Uh, she has been very generous with her time to come here today and share her story with us, her story of the struggles and the path to healing, and then the ongoing struggle and the ongoing hope. The idea is to describe to other patients how they can find hope and how they can find solutions in the path of healing. Please introduce yourself, Sarah. Please tell us a little bit about you as a person and then your profession and then how the chronic pain started and how did you find the path to move forward.
Thank you, Dr. Rod. Thank you for having me as a guest. It means a lot to me to potentially tell my story to help other people who are struggling with chronic and acute pain. I'm Sarah James, and I am a supervising producer on the popular TV show The Amazing Race Canada. We're the highest rated TV show in Canada, so maybe some of you watch it, and maybe some of you will watch it now that you're seeing me. Um, and I've been working in film and television for my entire career since I was 16. I'm 61 years old now, which is phenomenal that I look this awesome. Um, my journey with chronic pain started at a very, very young age. I grew up with a fair bit of childhood trauma. There was, family trauma that I don't need to get into. There was things that I was exposed to that were very, very scary for a little child that really flipped my probably normal childhood
Right.
into my brain being in flight, fight, freeze mode. Never fight, more like freeze or flight. So from the age of probably 4 to around my 30s, I was very anxious. I was prone to panic attacks. I would have to be taken out of school because I was having panic attacks. I couldn't ever go to sleepovers. And around the age of 19, I started experiencing pain at weird times in weird places in my body. And I was diagnosed very early on with the word fibromyalgia. It was a very new thing this was like the very early 80s. No one had really heard of fibromyalgia. And then I moved to Los Angeles to learn my business and kind of kept up the charade of not dealing with any of it and just becoming a workaholic and loving my work. And then I came back to Canada in the 90s and got myself into a rather abusive first marriage, and that ended, and that too caused my anxiety and pain to become worse, but untreated and undiagnosed. And then finally, um, in my early 40s, um, about 39, I met the man who's now my husband. I call him my real husband. He's amazing.
Amazing. Yeah.
Patrick is a high school shop teacher. We have a daughter who's 22. And I started to get into therapy with people who understood and diagnosed me as being a person with anxiety and disorder, panic attacks, and phobias. And I started getting treated for the pain. But as I got older and older, the pain started to get worse and worse. And what I realized about 3 or 4 years ago was that I was having a lot of pain in my lower back. And this is because my job, while very, very busy and full of multitasking and marshaling the troops and what I call herding the cats to get a TV show on the air as a team effort, most of my show life is sitting at a desk and doing this. And this created a back full of herniated discs. And so the pandemic hit. The pandemic hit. And like a lot of people, I think I just fell apart. That
Right.
that whole period was so terrifying for the whole world. And I'm a person who's privileged. I'm I'm a white woman. I have a good job. I have a good home. My husband has a good job, but something about the pandemic just triggered all of my childhood fears. Um, and I became very, very focused on the pain in my back. And during lockdown, I went to the emergency room 3 times because the pain in my back was so severe. And eventually, the emergency room at Toronto Western had a neuro surgeon check me out to say, yeah, you've got seriously herniated discs in your lumbar spine. And they scheduled me for surgery in May of 2022. And unfortunately for me, that surgery failed. It's called failed surgery syndrome. It actually made the pain in my lower back worse. And at that point, I was talking to a lot of friends um, who said, do you know the book, The Brain That Heals Itself? And I had actually read it years ago. But then what I did, and this is going to make you laugh, Dr. Rod, is I Googled pain doctor in Toronto who treats the brain pain connection. That's what I Googled to find you. No one sent me
Okay.
to
I
you.
never knew that.
Yeah. And your name came up over and over and
So I'm
over.
the doctor that has a brain pain connection.
You're right there on the search engine because your book came up,
Yeah.
right?
The Mind Body Temple book here.
Yeah.
Yeah.
And I thought I'm never going to be able to get in to see this person, but I was able to get in very quickly. And at our first meeting, we talked a lot about the fact that I already had a bit of a leg up because I've been meditating my whole life.
Right, right.
So I grew up in a household where in the 60s, 70s, my mother was really into yoga. And I'd always done yoga until I couldn't anymore because the herniations and the pain
Yeah.
stopped me about 3 or 4 years ago. But I did know about the brain pain connection. And my first meeting here with you, I bought your book, which is so much easier to read than the other book, The Brain That Heals Itself, because it's sort of more of an academic book, I
Yeah.
feel.
I made a point about that book, The Mind Body Temple, to make it more of a baseline of information, also more of a workbook for patients.
Yeah,
All the recommendations, all the knowledge that I want to transfer to patients, but during our doctor-patient encounters at the visits, we may not have enough time.
yeah.
So that was the whole purpose of the book. So it can be a companion to our clinical work, or it can be a standalone help for patients who want to get better for their pain or they want to elevate their life.
It's really accessible. And the other thing I really, really like about the book too is the people that you treat. When I'm out here in the waiting room to see you once a month, it's a very diverse group of Torontonians. And what's really beautiful, and I'll circle back to my spiritual life in a second, is there's everyone sitting out in that room is in a lot of pain.
True.
And a lot of them are in way more pain than me. Like I have chronic sciatic pain, and my lower back feels like it's being punched with a bunch of daggers. But there are people in there who I can just see are barely hanging on. And what happens is we start to talk to each other.
Right. Yeah.
And this thing happens in your waiting room once in a while where there's this just exchange of a bunch of complete strangers being kind
Yeah.
and listening or being supportive, and people in wheelchairs, people who are from different countries and different cultures. And that's the other thing I like about your book. If some of those patients read it, if English is not their first language, it's also extremely, extremely accessible, I find.
That's right.
Yeah.
It's not complicated, and that's the whole
No.
point of it. And as you said, the patients connect to each other. They realize that they are not alone.
Yeah.
It's that element of why me changes because they realize that they're not alone in this journey and there are others that are struggling. And once you start to help each other,
Yeah.
that brings a lot more value into the journey of healing.
Spiritual journey is that I was born into a family of two parents who are Jewish atheists who grew up in the London Blitz, in London, like with people all around them, houses being destroyed, German bombs dropping on them, and the knowledge after the war that if the British and the Canadians and the Americans and the Russians hadn't defeated the Germans, I wouldn't be here speaking to you right now.
Right.
And that was drummed into us as children. My dad just became very obsessed with anything to do with the story of the Holocaust. And that's what made me a very, very nervous child. And when my first marriage ended, I delved into this subject with a really wonderful therapist, Dr. Andre Stein, who was himself a hidden child in the Holocaust. He's now in his 90s, but when he was a little boy, his family were taken away and killed in the camps, and he was hidden in a closet by some kind neighbors in Budapest who kept him hidden for the whole war, and he became my therapist. And
Amazing.
he introduced me to the idea of how many Jewish people who are atheists are drawn to Buddhism. And that was like in the late 90s. And really, since then, I've delved and practiced Tibetan Buddhism as a way to help me cope with anxiety because there's not a lot of room for anxiety if you're here and now, right? Instead of dwelling on, oh, what's going to happen tomorrow? The pain's
Exactly.
going to be terrible, or I did a bunch of things yesterday that I shouldn't have done that might have been bad for my pain. If we're as present as we can possibly be, and it's very hard to do.
It's true. That's why we use the breath as an anchor to bring you to the present moment.
Right.
That's the essence of when you're in the present moment and you're not in the past. The past brings you guilt and shame,
Yeah.
and the future brings you worries and anxiety. And
Right.
being in the moment is the cornerstone for healing.
Right. And then Dr. Rod very wisely referred me in about last May, so it's just about Christmas time now, to say you might be interested in doing Qigong, which the only thing I knew about Qigong was that when you drive by the Chinese embassy here in Toronto on St. George, there's always some Chinese people out there doing Qigong movements because in China, it's illegal to do as a spiritual practice, or it was, and they would be persecuted for that. So they're protesting and doing their energy movement
Energy
as a
work.
spiritual movement outside the embassy. That's all I knew. And Dr. Rod told me about a wonderful Qigong teacher called Steffi Black.
Yeah, she's
She's
amazing.
amazing. And I called her, and she came to my house to show me the first few things. And now every Tuesday at 7:30 and every Saturday at 9 a.m. Sometimes I miss a class, but I do Steffi's class, which is an hour long. And for all of you out there in really extreme pain, you can do Qigong lying down and just watch it and benefit from it, or you can do it just sitting in a chair. But the movements are about moving energy that exists in our bodies to help us heal pain and help others heal from pain.
Yeah.
And like I said, I was raised in a very atheist household where my mother was like anything to do with energy healing or spiritualism of any kind was kind of frowned upon. So I wasn't sure about this energy healing. But then you realize that our bodies are made of water, carbon, um, other visceral things like our platelets and our blood, but our bodies are also full of electrons. Our bodies are made of electricity. And when you start to do these movements in Qigong and really give them the attention they need, and the movements are to help your body heal from pain, but also you're sending your love and compassion out to everybody in the world who might be needing to heal from pain as well. It's very, very powerful.
Yeah, and there have been studies for chronic pain patients that they have been doing either Tai Chi
Oh,
practices or Qigong that they had shown improvement with those practices. So it is scientifically shown.
I totally buy it. I did try Tai Chi years ago for my chronic pain, but I have a litany of things. I have, on top of having an anxious mind and a busy mind, I have ADHD. I'm a very speedy person. That wasn't diagnosed until my 40s, but it explains a lot. But the thing with Tai Chi that didn't work for me at all is you have to memorize all these different moves. You actually have
Right.
to memorize them. And you learn one every week, and then there's when I did it there was no video or anything, and I just couldn't keep up.
It's
Whereas the
hard to keep.
Qigong, you like someone like Steffi, and her teaching prices are so unbelievably reasonable that anyone can afford to learn from her. But Qigong, you don't have to memorize any movements at all.
That's right.
And you can do the classes free online through Spring Forest Qigong. So that's helped me a lot with my pain. I think the other thing, and this is something that's really hard to get your head around, is this. My back has herniated discs in my lower back that are touching my sciatic nerve. So I live in a lot of pain in my lower back, and it's different every day. Some days are better than others, but I think what helps me in the things I've learned as a Buddhist and reading books like The Power of Now. I follow a wonderful Buddhist teacher called Tara Brach, Brach, who has free podcasts that changed my life. And then a lot of these teachings about pain are this, and this is something you've taught me too, Dr. Rod, is the pain, if you try and push it away, if you hate it, if you despise it, if you and I do this sometimes, like it's ruined my life.
Yeah.
It's made my life a lot smaller. I can't sit on an airplane for 5 hours. I can't I can't, there's so many things that I can't do that I used to do. But if I despise it, then I'm despising my body.
Yeah.
And if I treat it with care and love and almost treat my pain as this person that's part of me that just needs to be told, okay, you're part of me, you're here, you're not going anywhere. I'm going to have to love you and accept you, because when I do that, the twist of it loosens a little bit.
Exactly. When you face your enemy becomes smaller. When
Yeah.
you put your back to the enemy, the enemy becomes a giant. And that's
Yeah.
the way you look at your problem determines how big or small that problem will be. You have touched on so many important points. The most important is the importance of childhood trauma and how we are going to feel about ourselves and about our environment. And you mentioned things like ADHD and anxiety. Like if I'm being nasty to you, Dr. Gabor Mate touches on this very
Oh,
nice, says that a child, if I'm being nasty to you, you can object to me, you can ask for help, or you can, stand up and leave. But a child in a hostile environment cannot object to anything,
no.
cannot talk back, and cannot leave. So what the child will do is that the child will tune out. And that becomes the essence of ADHD. Instead of being fully aware of what's going on, they become, they jump their attention from moment to moment so they don't realize what is the hardship that's happening. That becomes the essence of ADHD.
You're
And
so right on,
yeah,
because my brother too has
yeah,
ADHD, and we there was just, We grew up in the 60s where corporal punishment, like hitting your kids if they're naughty, or the teachers
Yeah,
would hit children back then. They'd hit the kids with a ruler, or they hit you, they take you to a corner and smack you on the rear with a paddle or something. That never happened to me, but it happened to my brother all the time. But we grew up in a home where if you were naughty, you would get punished,
yeah, and then that,
physically punished.
yeah,
And so we spent some chunk of our childhood, and my parents could be very loving parents as well, but the same thing was done to them as
yeah.
children
If you don't
growing
know
up in the
better,
40s.
that's the way. Yeah,
But I was, you just become afraid, and you clam up. And also the memories as a child, they're just too much for us. And so we wipe the memory bank,
exactly.
you know? And it took a lot of therapy for me to understand what my parents went through and why they were so anxious. I mean, they were growing up with bombs and sirens, and,
Yeah,
death is at the door, Hitler's at the door.
that's right.
Right. So I forgive them for all of it. I just have nothing but love. I see my 86-year-old mom many times a week, and I just came from bird watching with her. And that's the other thing I want to say about chronic pain and things we can do for it, no matter how much pain you're in, is any opportunity I get to be out in nature is incredibly healing for the pain.
Exactly. Yeah.
Sitting is the worst thing I can do for the sciatic pain because there's herniations that then push on the nerve when I'm in this position. Walking is the best thing I can do. And every week, my mum and her friends who are in their 80s go bird watching down at the lake. And today I joined them. And it was just so delightful.
It is. You find when you connect to the nature,
Yeah.
you're more in tune with the flow of the nature, the flow of universe, and you get closer to that state of flow. And
Right.
then it's as if you're moving with the flow instead of opposing the flow direction. And
Right.
that's when you're resisting the pain, when you're despising your pain, and then through that despising your body, it's as if you're resisting the flow of nature. And then you become in fight with yourself, and you cannot focus the healing energy towards your ailment, towards your condition. Once you accept, then you can commit to the improvement. Then you can,
Right.
it's at that point when you make peace with yourself, then your skills will come to your rescue. Then you can apply different skills. Many people know a lot of skills, but it doesn't help them because they are in fight with themselves inside and they don't know it.
Right. Right. I was watching your podcast with a woman called Tanya who spoke about that as well.
Yeah,
And she went through some terrible times. And, depression is just the worst thing when you have chronic pain. And, I'm not saying every day I'm able to be completely present, and not every day can I. Some days my pain is really bad and I slip into self pity, and I have a kind of crappy day. But then I always tell myself, tomorrow I will get back on track. And I do. Like, I try not to let too many days go by of letting myself feel hopeless, because um, the the joy I get in many, many, many parts of my life is there for me. And that joy kind of trumps the pain a lot of the time. The joy of having a little garden that I can look out on when the lilac trees are blooming, or my husband put a bird feeder in the garden for my
yeah.
birthday. And I just, I don't know, I can't resist watching cardinals. And I have two cats that I love that like to watch the two cardinals from behind the glass. And I have family and a job, a job that I really, really love, that I really excel at. Yet in my worst moments of despair, I worry that I'm going to lose my job because the pain is going to become obvious, and, um, they might decide to hire someone a bit stronger and younger than me. Hasn't happened yet, but I'm aware of it, and that plays on me sometimes.
Yeah, through all of these connecting to the nature and enjoying every little things that we have every day and we pass by them without paying attention to them, that element of mindfulness comes to your rescue because you are a practitioner of mindfulness.
Yeah.
Now you pay attention to every little things that others may not pay attention to. But
Mm.
when you pay attention to all of those things that may seem small, there is a word of value in each one of them. And then you mentioned something about creating a scenario in our mind about future, and right away we start suffering from them.
That's right.
That's the essence of anxiety and worries, which is living in future.
Yeah.
That's why, again, being the practitioner of mindfulness and meditation that you are, coming to the moment, coming back to your breathing. We
Yeah.
talked about that notion of practice of safety. You come back to your breath and you tell yourself, I am safe. With that one practice, when you keep doing that, you feel better about yourself and you let the worry go. Because you believe that the only permanent rule of universe is impermanence.
Right. Right
Every,
on.
everything changes.
We
So
know nothing.
all you have to do is to remember
Yeah.
that when you are in down moments, you
Hmm.
remember that things will change and this shall pass.
Right. Right. The inside of one of my rings says, "This too shall pass."
Exactly.
There's two more pieces that I wanted to share with your listeners because sometimes just following the breath is hard to do and it takes a lot of practice. And some people have this mistaken idea about mindful meditation that it's about emptying the mind or not thinking or, like having no thought passing through. It's impossible to have no thought passing through. So there are other forms of meditation. Because I have a very busy brain, I have an ADHD brain, I find it very hard to follow my breath. And I've done a lot of training in that where I can count to 10 as you exhale, count to 10 as you inhale, and I might get to 2
Yeah.
before some thought intrudes. So I learned another form of meditation from some great Tibetan teachers I was studying with there in California years ago. And there's other meditations you can do to distract your mind from pain that are really simple and beautiful. And they are just sitting and like sitting at a window maybe, or just even sitting in your house, or lying if it hurts too much to sit, or doing it when you're walking outside. And you start with just listening to every single thing you can hear
Right.
and name it. Sometimes I even name them out loud. The trees are rustling. There's a bird chirping. There's a car going by. All the things that you can hear. And then you bring in your field of vision and you start to name out loud, there's a beautiful maple tree that's turning for autumn from orange to red. There's a squirrel running up the tree. There's a car going by. There's children playing with a ball. And I still hear these things and I see these things. And you do that. And then you bring in, how does my body feel right now?
Right.
Well, I have this very, very strong pain in my lower back that is hurting me right now. And the other thing I struggle with is very, very severe tinnitus. A lot of people with pain have tinnitus. It seems to come hand in hand. But then I recognize how my body feels while I'm hearing, while I'm seeing the things and naming them. And then you ask your body and mind, well, what emotions am I feeling right now
Right.
as I'm walking out here, listening, seeing, feeling my body, even if my body doesn't feel very good right now. And often the emotion is, I'm okay. Like I'm pretty mobile.
Yeah.
I'm not I'm not a tragic case and I'm still able to do my job. I just bring my pain with me.
That's amazing. Like what you mentioned is something that we talked about, and I always tell my patients that don't fall into two traps related to meditation.
Yeah.
First of all, you don't have to do it perfectly to benefit from it.
No.
Just by attempting to do it, the fact that you're trying to do it, you're just working on those neurocircuits in your brain. And the more you do it, the better you get at it. The second, don't do it and check if you're getting better or not. Because when you are checking, you are in future.
Yeah, there's no
And
such
future
thing.
brings you worry.
Yeah.
So do the work for the sake of work and the results will come.
Yeah.
So if you don't fall into these two traps and keep doing it,
Yeah.
the research shows that any form of meditation will have the results over time. So
Yeah.
there were researches done on all the other researches that have been done related to meditation to find out which one is more effective. And they realize they're all good. They're all effective.
Yeah.
If you keep doing it, just do the work, stay with the practice, and the results will come.
Right. Right.
Now, you have done a great job in describing your whole journey.
Mm.
And I really thank you for giving your time to bring more hope to the patients.
Mm.
As the final thoughts, if you want to give one or two hopeful thoughts to patients so they would believe that there is hope for them, what would you tell them?
I would say you're not alone. And, there's a lot of people with chronic pain who live alone and have to manage alone. But I encourage you to talk to the people in the waiting room here and talk to the person in the park or talk to your friend, or even when you don't feel like it, connect with people. Because I, for example, are having some people over for dinner tonight and I'm in a lot of pain today and I was going to cancel. But then I realized, oh, okay, that's going to distract me from my pain.
Yeah.
Talking to people, being with people, or find something that you love to do that brings you joy and do those things. And that can be as simple as singing to yourself. I do a lot of singing to myself when I'm in pain too,
Good for you.
because I do this therapy called havening,
Mm-hmm.
which I'd love you to look into. I've mentioned it to you before. It's a form of somatic healing called havening that is for trauma and pain and anxiety. And in havening, you're encouraged to find little things that bring you joy. Singing to yourself, stepping outside, and connecting with people. Even when you really, really, really don't want to, because I know this, people in pain, I'm looking right at all of you. It is so hard to get out there when everything hurts. But then I do, and I'm distracted by people making me laugh, or people being kind, or people being uh, people singing with me because I sing in a choir. You just I have to push myself out there sometimes. And I encourage people to do that.
That's amazing. And then look at you. You're here sitting and, helping everybody else who is suffering from this chronic pain. And then this is a journey of healing. And when we connect, we can help each other to heal. And
Mm.
there's nothing more beautiful than helping others. When you help anyone else, you're helping yourself.
Yeah, it's a mitzvah.
Yes, exactly.
Or good karma.
Yeah,
All
yeah.
means the same thing.
Different names, different, same meaning.
Well, you're the one doing it and teaching it, Dr. Rod. I think you have a very, very unusual practice. This is not what I expected when I thought this is not what you picture when you come to a pain clinic.
I always say the pain is an excuse for you to come to me so
Mm.
we can share these ideas.
Yeah.
Each patient that I've seen over years, they have different skills. They just need a method. So the method that we talked about in this clinic is the method that how you find the reason for everything that you do, how you find your purpose,
Mm.
and then you make peace with yourself, and then you use the skills in order to feel better. Then you feel that you are enough. All the years that you thought that you're not enough since childhood,
Mm.
it's been a defense mechanism, but now you don't need to overplease anybody because now you accept that you are enough. And then you feel that you are part of the whole because all is one. You believe in that. And then you just allow yourself to enjoy your life. You let yourself to have those moments of enjoyment, and
Yes.
then you get step by step closer to your true self, authentic self. These are the elements that would fundamentally help you in every aspect of your life, not just for your chronic pain. But I'm glad that chronic pain was a connection between me and my patients, so I could share these stories and this methodology. It can help for chronic pain, for anxiety, for depression, or any other aspects of the life. Once you know why you want to do things that you want to do and you are in peace with yourself, you can move on in your healing.
Thank you very much.
Thank you for giving this time and coming and sharing all these ideas. Thank you so much. I can't thank you enough,
Okay.
but I'm sure that many patients would benefit from your story.
Yeah, if any patients have any questions about some of those methods of healing, like havening or EMDR therapy, um, let me know and I can write to them or something.
Beautiful. Thank
Okay.
you so much.